At the culmination of approximately 40 weeks of pregnancy, a woman will begin to experience labor. Labor signifies the impending delivery of the baby. To help alleviate the discomfort of childbirth, many women will elect to have a procedure called an epidural to numb the lower body. Prior to this procedure, the woman may be given an IV infusion of fluids to help maintain blood pressure. The woman is then asked to lie on her left side and bring her knees upwards towards her abdomen. However, this procedure is occasionally performed with the woman sitting up with her back rounded. Once she is in position, the doctor locates the appropriate section of her spine, cleans the area, and injects a small amount of local anesthetic to numb the skin at the injection site. Regardless of her position, the woman must remain very still while the doctor slowly and carefully inserts a fairly large needle into her spinal column. After the needle is advanced slightly, a syringe is attached to the end of the needle. The needle is then advanced further with one hand, while the thumb of the other hand is used to apply pressure on the syringe plunger to detect a loss of resistance. The success of the procedure hinges on placing the tip of the needle in a space that lies just outside the membrane surrounding the spinal nerves. The membrane is called the dura, and hence the procedure is called an epidural, and the space the epidural space. Placing the needle tip in the epidural space takes much skill and requires a subjective feel. The Episure auto-detect syringe was developed by Indigo Orb as an essential tool to alleviate the subjectivity associated with the use of thumb pressure. The uniqueness of Episure is in the engineered spring action that results in a precise, constant pressure on the plunger that in turn allows the physician and his team to visually detect the plunger action while both hands are focused on the steady, controlled advancement of the needle. Episure is an invaluable tool that will not only provide better control for the experienced physicians, but more importantly, will provide an added measure of confidence and safety for our up-and-coming physicians. We at Indigo Orb, with the support of physicians around the world, strive to implement Episure as the standard in epidural syringes.